Your attention is given to the report on the topic, Functional Model of an Electrocardiological Study. Authors are Anna Filatova, Anatoliy Povoroznyuk, Mohamad Fahs. Department of Computer Engineering and Programming, National Technical University, Kharkiv Polytechnic Institute, Kharkiv, Ukraine. With the advent of new methods of functional diagnostics in cardiology, the need has arisen for the automatic analysis of large amounts of information. Therefore, the design of medical decision support systems in cardiology is an urgent scientific and applied task. Most of the signals, including ECG, obtained as a result of functional diagnostics of the heart and cardiovascular system, belong to the biomedical signal with locally concentrated features. Considered biomedical signals with locally concentrated features are quasi-periodic signals that have a complex shape and carry information about the state of an object on small fragments of the signal observation interval. Different classes of medical information systems in cardiology are used both for the purpose of introducing and storing the necessary information, with the possibility of creating various kinds of reports and protocols of study, and for the purpose of forming a computer diagnostic conclusion that is used to make a final decision by a specialist doctor on the state of heart and cardiovascular system. In the design of decision support systems in cardiology, the following main stages of processing biomedical signals with locally concentrated features can be identified, which are presented on this slide. The aim of the study is to develop decision support tools in the design of cardiological computer diagnostic systems, based on the morphological analysis of biomedical signals with locally concentrated features in order to improve the efficiency of the ECG study. To achieve the stated objective, this work addresses the following tasks: to develop a functional model of the ECG study, to perform the design of cardiological DSS based on the developed functional model. Let us imagine a functional model of the ECG study using the methodology of functional modeling IDEF0. The context diagram represents the ECG study as a whole and shows the connection with the outside world. To perform an ECG study, there is first a need to have patient data, anamnesis data, and patient's functional examination data, as well as a referral to a study that indicates the type of ECG study. All these data are the inputs to the context diagram. As a result of the ECG study, the patient receives a protocol in which the necessary information about the ECG study, the result description of the ECG study, and the diagnostic conclusion. Any study, including electrocardiographic, is carried out in accordance with the legislative framework. Therefore, the regulatory documents are the control of the context diagram. Finally, the patient's ECG study is conducted by medical staff using an ECG diagnostic complex that allows the recording of the necessary ECG leads. For the functional decomposition of the context diagram, 4 main activities were identified. Activity 1 is to register a patient. Activity 2 is to perform registration and analysis of ECG. Activity 3 is to perform diagnostics. Activity 4 is to form the ECG study protocol. The questionnaire data, anamnesis, and functional examination data of the patient, as well as the direction for the study, are received at the entrance of Activity 1. Medical staff using the appropriate modules of medical DSS forms a new one or fills in an existing medical record. At the same time, the data from the medical card along with the regulatory documents are the controls of Activity 2. Activity 2 has no inputs since the data from the medical card and regulatory documents are the controls. This data allows the configuration of the required parameters of the diagnostic complex, as well as a selection of the desired type of study. The medical staff using the ECG complex performs the registration of the necessary ECG leads, and the decision maker with the help of intelligent modules of DSS performs further analysis of the received signals in order to determine the diagnostic signs. Thus, the outputs of Activity 2 are diagnostic signs, and the mechanisms are the patient, the medical staff, the decision maker, the ECG diagnostic complex, and the DSS. The input of Activity 3 receives data from the medical card, as well as diagnostic signs obtained at the output of Activity 2. The decision maker, using intelligent modules of DSS, forms a diagnostic decision, which is the output of Activity 2. As a result of Activity 4 by medical staff using DSS based on the data from the medical card and the diagnostic decision obtained at the output of Activity 3, the ECG study protocol is filled. Thus, taking into account the main selected activities, there is made decomposition of the context diagram of the functional model of the ECG study, which is shown in this slide. It is easy to see that the first and last activities are fairly easily automated, especially if there are standards for maintaining medical cards and processing study protocols. The quality and efficiency of the ECG study are more influenced by the results of Activities 2 and 3. Therefore, only for these activities one of the mechanisms is the decision maker and intelligent modules of the DSS. In addition, errors at the stage of ECG analysis are critical for the entire process of the ECG study. Therefore, further decomposition of Activities 2 and 3 is performed. As a result of the decomposition of Activity 2, to perform registration and analysis of ECG, the following functional blocks are allocated. Functional Block 2.1, to perform registration of ECG. Functional Block 2.2, to perform ECG pre-processing. Functional Block 2.3, to perform morphological analysis of ECG. Functional Block 2.4, to form diagnostic signs. With the help of the ECG diagnostic complex, the medical staff records the necessary ECG leads from the patient, so the output of Functional Block 2.1 is raw digital ECG. In this case, Functional Block 2.1 has no inputs, since the data from the medical card are used to configure the ECG diagnostic complex. Raw ECG is the input of Functional Block 2.2, in which medical staff using the appropriate DSS modules using digital signal processing performs various types of ECG pre-processing. From the output of Functional Block 2.2, the processed ECG leads are fed to the input of Functional Block 2.3, which results in the signal marking and the amplitude time parameters of the found ECG structural elements. Morphological analysis can be carried out both in automatic and semi-automatic or manual modes using the corresponding intelligent modules of DSS. The parameters of the structural elements obtained as a result of executing functional block 2.3 are sent to the input of functional block 2.4. As a result of performing functional block 2.4, the necessary diagnostic signs are formed. In this case, all decisions are made by the decision maker using the DSS semi-automatic mode. When the decision maker has the ability to adjust the decision developed by the DSS, or manual mode when the DSS is used as an information retrieval system. In functional block 2.4, the automatic mode of DSS, as a rule, is not used, since uncorrected errors that occur at this stage can later lead to diagnostic type 1 and 2 errors, which reduces the effectiveness of the ECG study and is critical for the choice of further treatment tactics. As a result of the decomposition of activity 3, to perform diagnostics, the following functional blocks are identified. Functional block 3.1, to find previous studies. Functional block 3.2, to analyze diagnostic signs. Functional block 3.3, to estimate dynamics. Functional block 3.4, to estimate the effectiveness of treatment. Functional block 3.5, to make a decision. If the patient undergoes an ECG study again, then to develop a complete diagnostic decision maker, it is necessary to obtain data on previous studies. Therefore, the input of functional block 3.1 receives information from the medical card, and the medical staff using DSS searches for data on previous studies. If previous studies were found, then these data are controlled by functional blocks 3.3 and 3.4. In addition, medical history data is selected from the medical card, which is one of the inputs of functional block 3.5. The diagnostic signs obtained as a result of activity 2 are fed to the input of functional block 3.2. At this stage, the decision maker can also use DSS both in semi-automatic and manual modes. The result of functional block 3.2 is a preliminary diagnosis, which is the input of functional blocks 3.3, 3.4, and 3.5. If, as a result of performing functional block 3.1, previous studies are found, then the following functional blocks can be performed. Functional block 3.3, if previous studies are conducted as a result of, for example, screening, and/or functional block 3.4, if previous studies are conducted in after treatment. For performing functional blocks 33 and 34, data on the results of previous studies act as a control, and a preliminary diagnosis is an input, taking into account the preliminary diagnosis of the decision maker with the help of the corresponding intellectual blocks of DSS. There is produced a conclusion about the dynamics and/or effectiveness of treatment, which, together with anamnesis and preliminary diagnosis, are fed to the input of functional block 3.5. If previous studies are not carried out, then functional block 3.5 is performed only on the basis of the history and preliminary diagnosis data. In functional block 3.5, the DSS can also be used both in automatic and semi-automatic and manual modes, with the decision maker using the appropriate DSS modules. The developed functional model of the ECG study is shown that the most important works are carried out by the decision maker with the help of the cardiological DSS. In the most general form, the proposed cardiological DSS can be divided into two logical parts presented in this slide: the automated workplace of the medical staff and the decision support system itself. Each part has its own control unit of modules and its own interface for communication between the respective modules, as well as for communication between the specified parts. The automated workplace of medical staff is intended not only to control the ECG diagnostic complex, which is used to record the required ECG leads, but also for registration of the patient in the system, as well as for ECG preprocessing. Functional Block 2.1 is implemented in the Data Collection module. Activity 1 is implemented in the Patient Registration module. Functional Block 2.2 is implemented in the ECG preprocessing module. DSS contains both intelligent modules such as a knowledge control module, ECG morphological analysis module, diagnostic decision-making module, and modules for simple data manipulation and visualization such as an information retrieval module, ECG and data visualization module, ECG study protocol generation module, as well as a database where all patient data and ECG study data are stored, and a knowledge base where the processing methods necessary for the intelligent modules of the DSS are stored. The knowledge control module is required in the learning mode of the DSS intelligent modules. The ECG morphological analysis module is intended for the implementation of functional blocks 2.3 and 2.4. And the diagnostic decision-making module is intended for the implementation of functional blocks 3.2, 3.3, 3.4, and 3.5. While these modules work in the case of using DSS in automatic and semi-automatic modes, if the manual mode of DSS operation is used, then an information retrieval module is started to implement functional blocks 2.3, 2.4, 3.2, 3.3, 3.4, and 3.5. The information retrieval module is also designed to implement functional block 3.1. The ECG and data visualization module help the decision maker to correct various decisions made by DSS or to develop its own decisions. Finally, the ECG study protocol generation module is designed to implement activity 4. This work proposes the functional model of an ECG study using the IDE F0 functional modeling methodology in the structure of the cardiological DSS based on the developed functional model. The proposed functional model of the ECG study allowed the development of a structural diagram of the cardiological decision support system based on the morphological analysis of the biomedical signals with locally concentrated features, and also to highlight the various modes of the cardiological decision support system: automatic, semi-automatic, and manual. Further research is aimed at developing an information model of electrocardiological study for the development of an informational structure of the cardiological decision support system based on the morphological analysis of biomedical signals with locally concentrated features. Thank you for your attention.